Hello everyone, thank you for joining us on the program Healthy Living. I'm Adesu Walsawage. Today we want to look at hypertension and its complications, okay? Because sometimes you just hear that, somebody suddenly slumped and died, or somebody went into a meeting, they had to roll that person out. You know, something will just happen, or somebody was watching a movie, you know, anything. And the next thing you hear is that the person just shouted and then the person died, or the person slumped and died. On investigation, you discover that the person surely had underlying issues, and most often the time, it is hypertension. Some persons don't know that they have hypertension, but probably we faith it so much that they stop taking drugs, they just leave everything to chance, believing that it will go away, wishing it away. It's not enough for you to wish hypertension away. It's not. So we have somebody in the studio, a doctor, who is going to be talking to us on hypertension and its implication. I know you know what hypertension is, but do you know the implications? Do you know why you should continue taking your drugs and all of that? So join me as I make welcome Dr. Egbodio Osage. He is a senior registrar at the cardiology unit of University of Benin Teaching Hospital. So he is a cardiologist. Happy to have you join us today.
Thank you very much for having me here today.
Okay, so it's been a while. How are you coping with the situation in the country?
Well, we are trying our best just to make sure that everybody is living well, health-wise, and to make sure that the country is safe.
And I'm also sure that the economic crunch in the country, what we're going through today, is also increasing people's BP, so to speak.
Exactly, because when one is stressed as a result of economic hardship or one or two issues, the patient or the individual is not able to do, of course, there will be tension. And when there is tension, what do you expect? Agitation will cause the blood pressure to rise.
Okay, let me follow them to say it as well.
Yeah.
All right, moving on now, Dr. Osage. Let's, I know that everybody know what hypertension is, but at least let's refresh our memories again. Yeah. Perhaps if we do this, people don't understand the need to take adequate care of themselves when they are down with hypertension, particularly the sufferers already.
Yes, it's very, very important that we discuss this issue of hypertension, which we commonly call high blood pressure. It's very important because though it's a very common topic to be discussed, it is also important that we keep re-emphasizing it to the general population so that they will know what it is, the symptoms, and the complications. Because we've seen of recent many people dropping dead for no just cause. When you do autopsy, then you will now discover this person must have had hypertension that he or she might not even have known while alive. So it's important because one of the common causes of mortality worldwide is hypertension and its complications. So it's important that we discuss it. What is it all about? It's all about the fact that somebody's blood pressure is elevated. I will try to break it down to make it simple for everyone. When one's blood pressure is more than 140 for the systolic and 90 for the diastolic, we'll say, oh, this person likely have what we call hypertension.
So it should not be more than...
It shouldn't be more than 140. You know, when you measure your blood pressure, there are two variables.
Yes,
we have the upper and the lower, and the upper one is referred to the systolic blood pressure, while the lower one is the diastolic blood pressure. So these two go together. So it's important that when the systolic is more than 40, and the diastolic more than 90, we refer it as high blood pressure or hypertension. And it's so common that there are many studies. More than 70 million persons are affected worldwide. And also, there are studies even going on in Nigeria that 1 in 3 persons is hypertensive.
1 in 3 persons, even when you don't have a family history.
So they are different. That's where we come to the different types of hypertension. Usually, there's one we call the primary, which is the essential. That one is usually it's genetic, it's hereditary, it's familiar. Oh, somebody's father was hypertensive, mother was hypertensive. There's this likelihood that this patient, or probability that this person might develop hypertension as he grows. Prior to now, those days we used to say anybody that has high blood pressure is usually within the elderly,
Yes.
those above 60, 70. But
Sure.
now, people even at age 15, 20, 25 start developing high blood pressure. So it's the prevalence is increasing every day, and the incidence also is also increasing for this. And most often the time, that's the primary, the essential hypertension. We also have the secondary hypertension, which can be due to other causes, not due to family history or whatever. Oh, so for example, somebody has chronic kidney disease for whatever reason. Over time, that individual will develop hypertension. Somebody has diabetic mellitus. Over time, that patient will develop hypertension. Somebody is on drug, those illicit drug, psychoactive drug. Somebody is on steroid, whatever. So over time, this patient or individual will develop. Yes. Somebody eats shabbily. This individual does not take care of his or her health, takes all manner of things. Over time, such individual will develop high blood pressure. So it's cut across individual, different age group. It's not particular to a particular sex, whether female or male or any age group. Even a child that is born today can have hypertension. Yes. And I must also let everybody know at this point, for scientific purpose, there are two forms of hypertension. We have
two forms.
Yes, there are two forms of hypertension. What we are discussing, what the general populace know about, is the systemic hypertension. We in the medical profession, there's another one called the pulmonary hypertension. That's a separate topic. But the one that we all understand.
No, just us about that one.
Yes, the reason why I'm saying that, because somebody might do a test, somebody will say, oh, you have pulmonary hypertension, you all think, oh, it's a normal regular hypertension. That is different. The one that is common, that we all discuss every day, that everybody knows, is systemic hypertension. So when somebody says, I have hypertension, what the person is systemic hypertension, he or she is trying to explain. But you should know there's another one called pulmonary hypertension. That's a topic for another day. But let's concentrate on the systemic hypertension.
Does that one also present like the systemic hypertension?
No, they have different presentation. That one is usually a complication from lung diseases.
Complication.
It's a complication. While systemic hypertension is a disease on its own that can either be essential or secondary. So that's how it is. And also, this hypertension we are talking about, it's so common that individuals don't even know they have it. It's different from malaria. You know, malaria, of course, is common. Oh, when somebody has malaria, oh, I'm tired, fatigue, headaches, lightheadedness, fever, and all that. But somebody who has hypertension might not even present with any complaint at all. Might not even have any symptom. In fact, the book will tell you that the commonest symptom of hypertension is no symptom.
No symptom at all.
Because you know what I'm saying is, some individuals will tell you that, doctor, but I'm not feeling a headache now. I'm okay now. Why are you telling me I have high blood pressure? By the time you start feeling headache, just know that complications are about to set in.
Wow.
That's the truth. So it's the reason why we need to emphasize on this concept is that people will not ordinarily want to go and check,
of course,
until they have symptoms. And we are not saying that you don't need to have symptoms before you go and check. Because in my little survey and studies, I discovered that most people who are hypertensive get to know. Maybe, for example, they had bad news, or they are bereaved. Suddenly they rush into the hospital. They did not check their blood pressure. Oh, that was the day they told I had hypertension. Ordinarily, individuals will not go. They will not go. They will not know until probably something try this.
Okay, let's look at the implications, the complications of hypertension. Let's take it from this angle. You know, there are some persons that you know, once they are on drugs, they take it for a while, but once they see that maybe the blood pressure has gone down a little bit, or for whatever reason, they just decide that no, I'm not taking these drugs again. We want to know if there are problems associated to not taking your drugs again, to abandoning your drugs without doctor's recommendation.
All right, thank you very much. We are already going towards the treatment of hypertension. Good, you have said it. Hypertension is treatable. That's true. But is there a cure? That's a subject for we to discuss. Oh, because somebody will tell you, doctor, I've been taking this drug for years.
I'm cured.
It's not an issue of whether you have to stop or not. What is more important to us as doctors is that your blood pressure is within normal range while you are taking your blood pressure medicine. That is what is important to us.
Is it possible to stop at any time? Just stop, and the doctor say, okay, stop, don't take this drug again, you're good.
All right.
That is, you're healed, you're okay.
All right, let me explain that. Like I did say before, that there are two types. The essential, which is the primary, and the secondary. If somebody has a genetic makeup to have hypertension, and the person in his late 40s has developed hypertension, high blood pressure, and commenced drug, there is really nothing you can do about it. Oh, let's assume you not place the person on drugs, and the person is on antihypertensive. Oh, the blood pressure is fine, 120/80, 110/70. And you say, oh, the patient is not telling you, doctor, can I stop? And you say, stop. What do you expect? If the patient stops that medicine, over time the blood pressure will pick up again, because there is already a genetic makeup. You can't change the gene. The gene is already there to be hypertensive. You get it? But if, for example, somebody has a secondary hypertension, which I said, oh, for example, somebody has kidney disease, and that kidney problem has been solved, completely solved, of course, the blood pressure is likely going to come down. So these are the two ways. So when people ask, should I stop or will I stop when I'm on antihypertensive, you should know which type of hypertension you are treating. If it is essential, that's the primary, it's very difficult for you to say I will stop. But if it is secondary, and the secondary cause is the primary cause is being addressed, therefore one can stop.
Okay, what about those who just stop on their own?
No.
I don't tire. I can't take this drug anymore.
That is usually the issue that we have with individuals. There's what we call P-burden. Patients will usually complain, doctor, I'm tired. I can't take my medications again. It's giving me a lot of stress. But I usually tell them, I asked one question the other day. I say, this medication, are they very bitter? They're not. So, do you eat every day? Yes. Therefore, if you eat every day and the drugs are not, you can take your pills. They're not so much that you cannot take. What is more important is that the pills are working. And if they are working and you are good, and the truth of the matter is that if you see an individual who is compliant with his or her medications, they are far, far better health-wise. When you examine them, you find that they do better. Even their body system, you will know they are better off than those who don't take it. Those who don't take, the truth of the matter, they are at risk of complications. What are the complications that can arise from not taking your medicine or from somebody who has elevated blood pressure, which is called high blood pressure? One, stroke. You see individuals who just fall down, weakness of one side of the body, cannot talk, lost consciousness. So stroke can come in. Beyond any other thing, there's what we call acute pulmonary edema. The lungs will be filled with water. Patient will become breathless, cannot breathe. Before you know,
because
oxygen.
the lungs are filled
because
with
the lungs
water.
are filled with water because the blood pressure is not controlled. So there are so many. Somebody can just lose blindness, sudden blindness.
Because of hypertension.
Yes, high blood pressure. So this complication, they are too numerous. And in fact, I told somebody the other day, a patient, I said, have you seen a patient with stroke? Have you seen an individual with stroke? And they are helpless. Somebody will have to take them, carry them, and I could imagine the psychological effect of that. So you can walk, you can talk, you can eat, you can take your medicine. It's far better to have the complications that can arise from elevated or uncontrolled blood pressure. So that is it. So if you are taking your medication, you are very sure that these complications will not arise. Oh, of course, there can be 1 or 2, 1% of it that can arise, but majority will not develop these feared complications that we'll be talking about. So it is, first, you need to know if you are hypertensive. How do you know? By checking your blood pressure. How do you check your blood pressure? You go to the hospital. Oh, there are sometimes you can have outreaches, medical outreaches in your locality. It's also good you go there. That might not be the first time. Somebody will say, they told me my blood pressure is high. You have to check and do other investigations.
So how often should we check our blood pressure?
Now, individuals who are not hypertensive, if you are not hypertensive, you don't have any family history. No, your father, mother is not hypertensive. Oh, once in a while, maybe for example, once in 3 months, you could go and check your blood pressure.
Okay.
You don't. But somebody is not hypertensive but has family history of hypertension. I usually tell those people, get your own personal
device, okay?
Device, the automated SFIG. go and buy it and be checking as often as you can and document it, because you are at risk. There's no blood pressure, high blood pressure now, but because you have parents who are already hypertensive, there's this probability that are individual. So I will tell such individual, start checking now as often as you can and document it down. While those who are already hypertensive, they are on medications, it's also good they check every day and document, because there's what we call hypertension, which is high blood pressure. There's what we call hypertension, which is low blood pressure.
So which is more dangerous, the hyper or the low blood?
Both are dangerous. But the twist is that I usually tell people that if somebody's blood pressure is high, we can easily bring it down with medications. There are myriads of medications that you can use to bring. But if it is low, it's not as easy as bringing it up, because you have to...
So if it's low, it's another dangerous problem?
Yes, it's another dangerous problem, because you have to admit such individual, you have to set a line, you have to give drip, you have to bring back the pressure up. So it's not as easy as I will just take 1p, blood pressure will go up. So if an individual is hypertensive, taking antihypertensive, it's also good you check every day and document. So that when it's coming down, there's what we call escalation and de-escalation of medications. Oh, somebody is on 3Ps for high blood pressure. Somebody is on 3Ps for high blood pressure. The doctor can de-escalate by saying, oh, your blood pressure is getting within normal. So can you take 2Ps? Can you take 1P?
Okay, start reducing the
medication. The medications.
Okay.
You get it? So there are many things a doctor can do. So because you know why I'm saying that? Some patients will tell you that, my blood pressure is normal. I don't need to go for checkup again. No. There are reasons why you need to go for checkup, so that we can know how we can balance between hypertension and hypotension.
Wow, that's fantastic. All right, what other complications should we be wary of once someone is hypertensive?
Now, beyond the stroke, the pulmonary edema I talked about, there's what we call hyperlipidemia. Too much of cholesterol can come from hypertension because of the metabolism of fat is delayed, is misnormal in hypertensive
because
patients.
Of that hypertension?
Yeah, so such individual is going to develop high cholesterol, and high cholesterol is the leading cause of what? Heart attack, what we call myocardial infarction. So if there's too much cholesterol in the system, patient can have heart attack. Meanwhile, the primary cause is the hypertension. So hyperlipidemia is another complication of high blood pressure.
Okay, for us not to suffer all of these complications that we have mentioned, what should somebody who is hypertensive do? What is the step-by-step thing that person is supposed to do? And I did hear from somewhere that if you drink a lot of water, it will also help reduce blood pressure. How true?
All right, we'll talk about that. Healthy lifestyle. That's the summary of how you can live well. Healthy lifestyle,
which include?
1, avoid too much salt. There are individuals, after cooking, they would like to have more salt. Once you are at risk of either hypertension or you're already hypertensive, you must avoid too much salt. Oh, some individuals will say, I don't like salt. What of the other Maggi?
That's seasoning. No, doctor, no call me. Seasoning cubes.
Do you know seasoning, they still have salt in there?
Tell me.
They do.
So, seasoning cubes.
Yes, they do have salt. So you reduce it. Too much of fatty food, fried this, fried that should be avoided. Individuals should take more of fruits, vegetables, these are things, water, yes. Water has a way of hydrating the system and all that. It takes much of liberal fluid intake, vitamins, a lot of vegetables and all that. Also exercise. It is advisable that you do exercise at least 30 to 45 minutes, 3 times, at least 3 to 5 times in a week.
A week.
It also helps to strengthen the body, the heart, make you stronger. It also helps to reduce the pressure, the blood pressure. So healthy lifestyle is good. Now, another thing in healthy lifestyle is risky behavior must be avoided. What are the risky behavior? Smoking. So an individual who is hypertensive should not be seen or heard smoking. Alcohol must be avoided. Before now, it is usually thought that if an individual can take less than 40 units or 21 units for male, for 14 units for female, in a week. But now, the recent studies have shown that even small quantity of alcohol is dangerous to health, more so for hypertensive patients. So if you have hypertension, avoid alcohol. Energy drink.
Totally. You know, sometimes you hear people say this alcohol is a soft one. It's not harsh as the normal alcohol. You know, like okay, this one is just okay. You know, I see people checking. I say, okay, this one is just 3% now. It's okay. This one is 2%. It's okay. Should they not take at all?
All right. For individuals, I repeat, so I don't be misquoted. For individuals that are hypertensive. Alcohol should be avoided. Now, I ask myself a question. When some people say this type of alcohol, what is alcohol? Is it not ethanol? If ethanol is ethanol. Okay. So maybe the only difference is not the percentage. 1%, 2%. That is why I'm not saying that. Recent studies have shown that even the minute percentage.
Even red wine.
Yes. Don't they have alcohol?
You know, sometimes they say red wine is good for the heart. You know, you take a glass of red wine, it helps your heart and all of that.
Not that, it helps. What about the other system? Beyond the heart, what about the liver? What about the kidneys?
Problem.
So you get it. So it helps for the heart. Does it help for the kidney?
For the kidneys.
Does it help for the liver? So these are things we need to look at a human being as holistic, as a whole. Not just, oh, this one helps for this. What about this?
What about the other
so
one
you get
that
it.
is
So
ailing?
those things, for me, should be avoided. And aphrodisiac, those drugs for stimulants, those stimulants should also be, because for individuals will tell you they take energy drink, those are things that can put the heart
they should run away. And we have quite a number of energy drink everywhere.
In the market. So
you know, it's quite unfortunate.
Very much.
All right, doctor, I want to say thank you for educating us. I'm hoping and praying that that person who is hypertensive, who has stopped taking drugs, will continue. Just see your doctor, okay? Don't just stop on your own. Anything can just happen, because somebody died not so long ago and it was discovered that the person was hypertensive, but the thing he did that was bad was he just stopped taking drugs and started fitting it, you know. It will go, it will go, it will go. All right, and let's stop deceiving ourselves, okay? If we do all of this, I'm sure we'll be well. Now that we know some of the things that can happen to you if you don't take proper care of yourself, if you're hypertensive, I want to believe that you will take a cue from this and do the needful. We want you to live long, okay? So don't cause your own death by being careless or negligent. Dr. Egbodio, thank you so much for coming on our show.
Thank you.
Hopefully we'll see you again very soon, because when I didn't see you for a while, I said, Kai, doctor, don't jackpot. I thought you had jackpot, and then your lines were not connecting. I was like, okay. But thankfully, you're still here with us. Yes, all right, we want all our good doctors around, okay? So I'm hoping that the federal government will do something to keep doctors in Nigeria. Thank you again. All right, we'll see you again next week. Bye-bye.